Um, Management technique for the problems listed above. So my first problem was secretion retention or sputum retention. It's trying to mobilize secretions. So a technique to manage that would be active cycle breathing technique with a sniff. Um, but I know the patient hasn't really been complying with her um, exercises she's been doing at home, as well as her mucal clearance at home. So I'm gonna have her input. I'm gonna take in consideration her input because whatever she's been doing, maybe she hasn't preferred or hasn't liked. So I want to take that into consideration. Um, Also, I would have the patient sitting. Only issue with that, she reports having a hard time getting out of bed just because, well, she's been under the covers. Um, Also, active cycle breathing technique will help with the assumed reduced lung volume, as well as reduced lung compliance and increased sputum retention. Um, Additionally, I would like to, for management techniques, I'd like to educate the patient on risks of smoking and drinking, especially with cystic fibrosis. Um, Also, implement an exercise plan for increasing your physical activity. Someone who used to swim so much or enjoy swimming, um, maybe talk about other forms of activity that she might find enjoyable. And I know there is a thoracic expansion component to the active cycle of breathing technique, but because of the reduced lung volume, um, want to prescribe some thoracic expansion exercises as well, just to work on increasing that lung volume, as it was one of the problems listed already. So I chose to use the active cycle of breathing technique because it puts less transpulmonary pressure than coughing, as it uses a huff, so less likely for airway collapse. Um, Taking into consideration what the patient reports with mucus and what the chest X-ray supports as well. The benefits of ACBT I found to be better than other management techniques. So just to speak on those, um, increased collateral ventilation during ACBT. There's a hold component, so that allows air from healthy tissues to move through the collateral airways into the less healthy tissues that were potentially blocked before, as well as adding a sniff, as I said I would, is going at the end of a deep breath, will help redistribute surfactant, which will allow for dilated alveoli to open as well. Um, this or ACBT also increases expiratory airflow for mobilization of secretions through creation, so it creates shear forces and also changes the rheology of mucus. So because there's at least 10% difference in expiratory versus inspiratory airflow, 10% more. As we do as the patient does the huff, they're able to shear some of the mucus off of the wall just through the pressure that's created. As well, ACBT, there's a alveolar interdependence. So expanding forces between the alveoli are greater than at tidal volume. So adjacent forces from these alveoli that are expanding will help other alveoli expand, enhancing recruitment of the lungs. So this comes from Phillips et al. 2004, supporting the active cycle of breathing technique as a valid, reliable technique for managing symptoms in those with cystic fibrosis. So, a few goals for the patient. First one, short-term goal. So this is something I want to accomplish within the next treatment, within the next 24 to 48 hours. So I want to reduce the patient's sputum retention. So that'll be accomplished through active cycle breathing technique in the clinic, as well as teaching them an active cycle breathing technique. That way they can do it at home or without me. I'd also advise them to try and do it twice before next treatment, so hopefully once at night and once in the morning before. In the 24 to 48 hours leading, I also want them to work on thoracic expansion exercise to aid in lung volumes. Couple that with the ACBT. And I want them to look into a cystic fibrosis group to talk. Maybe that'll help with self-efficacy, some of the other psychosocial emotions they're feeling from being bullied, as they're not going to be the only people in that group who's been through it. Also, looking at another more short-term, going and reaching into long-term goals, looking at week 2, I start to look at a physical activity plan, hopefully re-implement swimming into a weekly routine, even if it's just once or twice, something just to slowly start to build that feel for it up again. Get some self-efficacy being in the pool, hopefully with reduced in coughing and sputum retention, she'll feel more comfortable, won't feel like she maybe will cough in the pool, she won't have to suppress it. Looking more at the long-term goals, I would like to implement a long-term physical activity plan. So that being said, starting with maybe once, twice a week, working up to 4 times, 5 times swimming a week, eventually 30 minutes a day of activity. It doesn't have to be swimming. Anything that the patient enjoys doing would be sufficient. So again, with the long-term activity plan, she's quite sedentary after making new friends. So hopefully implementing this will help get her more active. Maybe, as I said earlier, reduce her chances of partaking in risky behavior. More time doing her activity is less time potentially spent with friends who could be influential, or also maybe you can get the friends swimming, who knows. Also would like the patient to continue with the cystic fibrosis group, as well as continue with their active cycle of breathing technique daily, just to stay on top of that sputum retention. While I was looking at, utilizing principal theories of behavior change. So right now I kind of think the patient's in the pre-contemplation phase. So I just kind of did a little breakdown of how to maybe progress them to the maintenance phase. So phase 1, I would try to raise awareness of importance of physical activity. Phase 2, I would talk to them about what activities she would like to do and what about them did they like and why. Just trying to make them think about the happy thoughts of swimming. 3, talk about getting them back into swimming. Talk about open swims, what days are available, at what pools. Maybe try to generate resources or ideas and try and really facilitate return to the activity. Number 4, start swimming once or twice a week. See if it's still enjoyable. Maybe she has passion for other activities. And last but not least, I try to make activity part of the routine. Swim laps 3 days a week. Start to try and implement it into that long-term activity plan.